Very much for staying with us. Now, as the world observes International Cancer Day, experts are warning that the infection rate is likely to double by 2030. That revelation comes from a study conducted by UCT actuary Dr. Emma Finestone and WITS public health expert Dr. Jody Wishnia. Now, experts are now looking at ways to contain the infection rate. For more on this revelation, we're now joined by Gary Feldman. He is the head of the healthcare at NMG Benefits. Mr. Feldman, good evening, and thank you very much for joining us. A very worrying revelation. I mean, one would think that with all the health and technological advancements that we'd probably be heading towards lower numbers, but here we are, we're expecting it to double. Your views on just this?
Good evening, and good evening to the viewers. Yeah, I think this is a concerning trend that we've seen in the healthcare industry over the last couple of years. And unfortunately, we do believe that this is going to carry on if people are not going to take action and try and identify the cancers early. And when I say identified, I think it's important that people learn to go for their testing. Most medical schemes in today's times do pay for the testings. And I think when I say testings, it's going for colonoscopies, going for mammograms, going for prostate tests. And as I said, I think those are the key things that people need to look at to early identify and go for regular tests to ensure that they are identified and picked it up early. Because if you pick it up early, your treatment is much more successful unless you wait until it's fairly far gone and spread across the body.
But are we going to see that honestly? Because just today is World Cancer Day, but it hasn't featured prominently, perhaps even on your social medias and conversations. Yes, there was the pink drive, but like I say, not necessarily featuring very prominently on just social media alone to sort of indicate that people are aware and talking about this and the need to detect very early. Why do you think this is when most families have been broken by cancer? We're all too familiar with cancer.
Yeah, I think the big challenge here is education. I mean, people don't take this seriously. When we consult to organizations and individual clients in the medical scheme environment, ultimately we look at, and the causes of cancer is people are smoking more, people are picking up weight, obesity is a key driver, eating highly processed foods. I mean, we see more and more people eating highly processed foods these days. And ultimately, alcohol consumption, all those are elements that are driving up the cancer prevalence in South African society. And it's not only in South African society, I think it's world over.
Could we attribute it, though, to ignorance here when we speak of the high processed foods? Because there are a number of people, even when we speak in the office here, where some would say, I've just recently discovered that highly processed foods cause cancer, be it your hams, your Viennas, but some were unaware.
Absolutely. I think it is basically a lack of education, a lack of people reading up around all these causes. And I think ultimately it's responsibility of consultants like ourselves at NMG to educate people, medical schemes to educate people, and then people just to learn and read up about these concerns themselves. I mean, if I look at the situation, if you go for your annual mammogram or your annual colonoscopy, you don't even have to go for an annual colonoscopy. If you go for a colonoscopy, the surgeon and the results will determine if you have to do it every 3 years, every 5 years, depending on what they find in the colonoscopy. But ultimately, I think everybody over the age of 50 should go for colonoscopy. And as I said earlier on, I mean, if you're on a medical scheme, most of them pay for that. And ultimately, it's just preventative of potentially having a cancer in the colon.
I want us to delve deeper into colonoscopies and colon cancer. But first, I want you to perhaps share with us the more prevalent cancers that we've noted of late.
Well, I think the three most prevalent cancers that we see is number 1, colon cancer, number 2, breast cancer, number 3, skin cancer, and also prostate cancer. I mean, those are the most prevalent cancers we pick up now. And I mean, you know, even skin cancer, I mean, there's ignorance around impact of the sun. If you get sunburnt, and that's why the sun is becoming more and more of a problem. People don't put on suntan cream, and ultimately you think you got a little mark on your skin and you just ignore it, but that could be the start of skin cancer.
Now, I'm not sure if it's just a coincidence, but I've been coming across quite a number of males, even on social media, that have been diagnosed with colon cancer. Is it more prevalent in men, perhaps?
I don't think we've seen that. I mean, if you go and look at your statistics and you refer to the research that's been done, I just believe that it's basically the amount of alcohol that's potentially, and yes, I think I don't want to generalize and that males drink more than females, but ultimately alcohol consumption and just ignorance is basically resulting in that quite horrendously.
And what are the common symptoms for colon cancer?
Well, I think the most important there is pains in your stomach, and then blood in your stools, and ultimately just uncomfort. And I think that is the biggest thing, is people ignore those symptoms up front, and ultimately they should take note of that and consult their GP first and foremost, and then ultimately have the colonoscopy done. And I think between your medical scheme and your gap cover product that supports that, because there are usually co-payments for these procedures. But if you have a medical scheme, between your medical scheme and your gap cover product, that will be covered in full. So it won't cost you as the member anything, and you've got the peace of mind that you've gone through the process, and ultimately you're safe for another 3 to 5 years before you need to have your next colonoscopy.
Now, sadly, even with all the information at our fingertips, there are still myths and misconceptions. Which would you say are the most common misconceptions that perhaps today we can tackle?
Well, I think every person should educate themselves. And as I said, I think even sleep deprivation is, if you don't sleep enough, and yeah, I mean, we all say that people are sleeping less and less, but sleep is an important point of your body to recover as well. So obesity, I mean, that is really making sure that you don't become overweight, following a healthy diet. Those are all key points that you can ensure that you don't become, and colon, this is all related to colon cancer specifically.
I'm glad that you touch on sleep deprivation, because many people take for granted that we do need to sleep enough. And some actually pride themselves in saying, you know, I'm somebody that can just get by with just 4 hours of sleep. I'm a go-getter. But clearly, it will be detrimental to one's health.
Absolutely. Yeah, I think we've seen that. And unfortunately, during the COVID pandemic we had as well, I think ultimately people didn't go for all these tests for 3 years. People were scared to go out. And basically a lot of hospitals only treated COVID patients. And once again, all these people didn't visit their doctors. Females didn't go and see their gynecologist, didn't have mammograms, didn't have pap smears, and people just didn't go for colonoscopy. So I think life is returning back to normal. And all I would like to advise people out there is to make sure you have these tests to prevent and identify cancer symptoms at an early stage.
And just lastly, are we seeing an improvement in diagnosis or detection here? Because for many, it's been a very heartbreaking situation where they would discover at the final stages of a particular kind of cancer, when they had been hopping from one doctor to another, and none of the doctors would be able to link their particular ill health to any cancer. Are we seeing an improvement in that?
Yeah, I think the important point there, once again, is that people stick to one doctor. I mean, if you do doctor hopping, unfortunately, every doctor has got to start treating you from scratch, and ultimately doesn't know your history. And I think it's important that you do the tests up front, do it as early as possible identification. It's much easier to treat a stage 1 cancer than a stage 4 cancer, because I think from a cost perspective and also from the potential recovery period, it's much quicker and easier traditionally if people are identified early at a stage 1 level.
I know I said that was the last question, but we love politics here. Let's talk the politics of cancer. By that, I mean the equitable access to cancer prevention, diagnosis and treatment. Studies show that we're still seeing more cancer deaths in the least developed parts of the world, or more specifically among the lower income earners. Why do you think we still see this inequality?
I think, and if I just look at the South African situation as well, I mean, in the public sector environment, your public hospitals don't have enough oncologists, they don't have access to enough medication to treat people, and that's the unfortunate situation that it's in undeveloped countries across the world, where there's not enough treatment supply around and available. And I think fortunately for the people that in South Africa that are on a medical scheme, the treatment is there, and every medical scheme option, no matter if it's just a hospital plan, does still give you oncology benefits. And I think that's important why people should take out a medical scheme and retain their medical scheme cover, even though economic times are quite tough.
But we do hope that there can be greater access for those without. Gary, thank you very much for your time, though, this evening. That was Gary Feldman speaking to us on Cancer Day.